Hi, welcome to the very last online video orientation. This is Radiation Therapy, a Caring Field, Part 2. So to continue talking about the emotional aspect of working with cancer patients, I think one reason some people think that it must be a depressing field is because they think maybe like what I thought when I was in high school. I remember I had this acquaintance, I wouldn't say a friend, I didn't know him good enough to be a friend, but I knew this guy that had cancer. He was going in for chemotherapy, and I imagined it as being like this big, dark, dungeon-like room with this giant machine in there. It turns out that's not chemotherapy, that's radiation therapy. Chemotherapy is just giving IV drugs, basically, to kill the cancer. But anyway, I kind of envision this dungeon-like atmosphere, and I think a lot of people think it's kind of like that, to where the environment in radiation therapy is just this really dungeon-like atmosphere where there's patients that are whining, and not whining, I should say moaning is a better term, in pain and agony and despair, and that there's all this death and dying going on, and wailing and crying out in anguish and gnashing of teeth, kind of this Old Testament kind of stuff going on all the time. Now I gotta be truthful, once in a while you do have a patient that's undergoing extreme physical distress, and it can be difficult to work with. But that's not at all the typical patient. Once in a while a patient's like that, but this is the healthcare field. We deal with sick people. Sometimes you're going to have sick, very sick appearing people coming in. But that's not typical for radiation therapy. The typical radiation therapy patient, if you haven't done your clinical visitation yet, the typical patient walks in, they look just like you and me, maybe a little more gray hair, maybe a few more wrinkles than me anyway, though I'm kind of starting to get there. But at any rate, the patient walks in, maybe slaps you on the back, tells you a dirty joke or something, and you walk in and you smile, and you really can share many laughs with your patients. That's much more typical, really, with the patients that we work with. So I think people just don't understand, if the typical patient was somebody that was wailing in pain and extraordinary anguish, and there was all this death and dying and stuff going on all the time, yeah, that would be a depressing job, I think. That's just not what we typically see in radiation therapy. If you've taken a psychology class, with respect to getting back to the importance of working in this field, if you've taken a psychology class, then maybe you studied something called Maslow's hierarchy of human needs. That's this little pyramid-shaped thing that describes at the very bottom of the pyramid the basic needs that people have. Food, air, water, things like that. Then if you satisfy those needs, you can move on to the next level of needs, and that's like safety and security, having a secure home to go to, things like that. Then if you can meet those needs, you can move up to the next needs, and they just kind of move up, and they get into needs that are more and more into the realm of self-esteem and loving relationships. And the top need, the pinnacle of the pyramid, as it were, is something called self-actualization. Self-actualization is essentially the fulfillment of the human potential. It's really kind of a spiritual state where you feel really completely fulfilled as a human being. And most people seek self-actualization through romantic relationships or church affiliations, and that's fine and dandy. I do those things myself. But you spend half of your waking hours where? At work. Wouldn't it be cool if your career, your work, offered you the opportunity to become a more self-actualized human being? How does radiation therapy offer that? All of us seek meaning and importance in our life. Working in radiation therapy, treating cancer patients, you can go home from work every day, every single day, and know that what you did that day directly touched people's lives. It was of utmost importance. What's more important than helping people live? Or if there's a patient that's beyond cure, helping that patient to have fewer symptoms, less pain for the time they have left. What's more important than something like that? So you can go home every day from work and know that what you did that day mattered. What you did that day made a difference in people's lives. What you did that day can help you become a more self-actualized human being, because what you do matters. That's kind of what self-actualization is. Not very many careers offer an opportunity for you to become a more self-actualized human being. Radiation therapy does. Very few do. We offer that. Whether you take it up, or whether you take advantage of that opportunity, that's in the ball's in your court for that. but the opportunity is very much there, very deeply there. I remember one time a student, an applicant, asked me a really interesting question. She asked, "What's the worst part about working in radiation therapy?" And I thought, wow, that's a good question. So I had to think about it a minute. And I finally, after thinking about it for a minute, I answered. I said, the worst part about being a radiation therapist is you can't lose weight working in radiation therapy. And she gave me this look that you're probably giving me right now, this kind of quizzical look, like, what? How does that figure in? Well, let me explain. My wife works in retail. If you've ever worked in retail, you know that customers can be a pain in the neck. Customers pretty much just whine and complain pretty much all day long at you. Well, our patients are kind of like our customers. Whereas my wife comes home and maybe sometimes complains about some of her customers complaining to her, and I sometimes feel almost embarrassed that I don't get that. There's a little flea flying around here. At any rate, I don't really get that much from our patients. Our patients are basically like our customers. Our customers, instead of complaining and whining, the typical patient, we're much more likely to see our patients bring us brownies, cookies, cakes, donuts. If you've been to your clinical observation, there's a reasonable chance that you saw food from some of the patients, brought by some of the patients there in the clinic. If not, you just caught them on a bad day, because more often than not there's food around. So that being the case, and at Christmas time it's insane the amount of treats and candies and stuff that the patients bring. So that being the case, it's impossible to lose weight working in radiation therapy. It's as simple as that. So unless you've got unbelievable self-will, it's hard to lose weight. Now, if that's the worst thing I can say about a job, a career, does that sound like a depressing job? I don't think so. Our patients care deeply about us, and we care deeply about them. I can see patients that I treated 15 years ago. I can still see them in the mall, and we'll recognize each other and hug and just introduce our family and stuff again. And I'll say, "Here's my kid. Look how much he's grown and stuff." And that's treasured for me. That's just so valuable. It's beyond words. I just can't say enough about our field. I think again, I'm biased. I think anybody be crazy not to want to be a radiation therapist. I honestly think, my honest feeling is that if people really knew what a cool career this was and how important the work is and how fascinating and wonderful and engaging it is and how we can grow as a human being, and if people knew all that, I'd have thousands of people applying to radiation therapy every year. But, people will still say, "What do you do for a living?" "I do radiation therapy." "Oh, you take x-rays?" "No, I treat cancer patients." "Oh, isn't that depressing?" I don't bother to give them my whole long spiel about what a brilliant career they're missing out on and how they just simply don't understand the gifts that this field offers. But I just usually let it go by saying, well, I don't find it depressing, but everybody's different. It's something that I find really rewarding. And they just kind of go, "Okay, well, fine, whatever." Well, that's, I guess, kind of their loss. But radiation therapy is, I think, the best gift I've ever given myself. And I hope that you complete that application and turn it in, and hope we can hook you up with radiation therapy. So just as a last reminder, be sure to turn in all of your keywords. Your last keyword, by the way, is the word triangle. I don't know what made me think of that word, but that's it. The last keyword is triangle. So be sure to turn in your keywords and all your other stuff. And then also be sure, now that you've completed the orientation, the online orientation, now the next step would be to also just contact me by telephone or email, and we'll set up a quick telephone orientation confirmation, which basically will consist of me talking to you about this orientation and answering any other questions that you might have that haven't been answered by this orientation process, so we can get you hooked up and get you all the information that you need for the field of radiation therapy. So again, thank you for your time. Take care.